As you start diving into the skeletal system and learning all of the fun features that they have, you might want to first start with the language of those features. So you're not just staring at something and trying to memorize what it is just by repeating it over and over again. You can actually learn the structure by translating it and understanding, oh, it's called this because it's describing this particular look. And so that's the goal of this video, is to kind of walk us through some of those common terminologies and what they mean. So as we're looking at structures, you're going to have them fall into some major categories. So you're going to have openings, and then you'll have parts that stick out. And so parts that are sticking out, those are going to be called processes. And so you have those processes, and then we'll also have kind of more flat spots. So let's first start with openings. As you're looking at different openings throughout the skeleton, they're going to exist for a few reasons, but mostly for passages of vessels and nerves. So you'll have these blood vessels, and then the bones just kind of forming around them to allow them to continue to pass through. The really big round, I don't even say really big, I guess it depends on size, but you can have these round openings, and so those are going to be our foramen. And so I think with foramen, I think whole, so they're going to be a little bit more round. There's, again, the goal of translation. So underneath the skull, if you flip the skull over, a big hole at the bottom for the spinal cord to come out of the, the attachment from the brain, that's going to be called the foramen magnum. The actual translation to that is whole big. You're going to have things like foramen ovale, meaning whole oval shape. And so if you're looking for something called foramen ovale, you're like, oh yeah, that's what that would be. Or if you see a jugular foramen, well, the jugular is the vein that drains from the head, so you're looking for a hole over by where the jugular vein would be. So translation helps make these words stick. Now, if you're trying to remember foramen, I think like foramen, like if you're out at work, they can be a hole. I don't know if that's a stretch, but we'll use it. And so you'll see things like a supraorbital foramen or an infraorbital foramen translated. It's literally saying infra, below, inferior, I for orbit, hole. So infraorbital foramen literally translates to below eye hole. Oh yeah, that's what that is. So foramens are going to be your holes. Then you have a meatus. All right, I'm going to actually write that. So hole, meatus would be more like a channel. And sometimes you actually see that those are interchangeable, and so this one's going to be more tube-like. And so this is going to be like we want to be protective. You'll see something like a carotid canal that would also kind of fall in the similar structure, where you're being protective of the carotid artery going up to the brain to supply it with blood. We have an external acoustic meatus. All right, so break down that term. External, outside. Acoustic, hearing. And then meatus tube, so it's the outside hearing tube. It's the hole for your ear. Once you start translating it, it's not as scary. You'll have a fissure. A fissure is going to be more like a slit. And so think of it kind of looking more like a comma, if you will. And so we have a superior orbital fissure that would be on the top part of the orbit. So if you take the eyeball out and you look in there, there's a slit at the top. There's also an inferior one, so that's why there's a superior, because there's one at the bottom. And so you'll see these slits, these fissures there. And so I think a fissure kind of like a crack through something, and that's kind of what it looks like. Now, another one that's an opening but you can't see, so it's more like a hollow pocket, and I don't know if it actually belongs under openings. Let's put it over here. So hollow pocket. So it's a pocket in bone. And you won't be able to see it. So it's going to be completely enclosed. So I'm going to do this to kind of show that it's inside, surrounded by bone on all sides. That's going to be called a sinus. Those of you who have allergies, you might be familiar with sinuses, because if they fill up with mucus, you can get a lot of pressure there. So when you're looking at sinuses, they're hollow spots inside of the skull to help make the skull lighter. And you just name them for the bone that they're hollowed out in. So a sphenoid sinus would be a hollow pocket inside of the sphenoid bone. A frontal sinus, hollow pocket inside of the frontal bone. A maxillary sinus is going to be a hollow pocket inside of the maxilla. You cannot see them unless the bone is broken open. So do be aware of the fact that those structures exist, even though you can't see it unless you're looking at something that's cut open or an image of a like a side cut or a mid-sagittal cut. All right, so those are some of your openings, foramens, meatus, fissures. Let's talk about things that stick off of a bone. So these are going to be your processes. With your processes, if that thing that sticks out is at an angle, we would use that term of a ramus. So I'm putting that over here. So if you're at an angle, that's a ramus. But overall, the processes we're going to fit into two main categories. And so you have the ones for muscle and bone attachment. So articulation is where bones rub together. So articular ones for holding the actual places where they rub. And then you have the ones for muscle. And so I guess instead of saying muscle attachment, I'm going to say tendons and ligament attachment. Because if you're attaching a muscle to a bone, that's going to be a tendon. If you're attaching a bone to a bone, that's going to be a ligament. So tendon and ligament attachment. And so if you're looking at attaching tendons and ligaments, you want to be rough. You're going to have places where it's going to be bumpy, so you can hold more firmly, because you're talking about these structures being made out of dense regular connective tissue. They're going to have collagen fibers that are going to need to have places to hold on to. So they're going to be a little bit rougher. And so these would be things like a trochanter, a tubercle, a spine, a tuberosity, a crest. Now, a crest and a spine, pretty similar. They're going to be arched, so that's what going to make these similar. Trochanter, tubercle versus tuberosity. These two are more bump-like. This is just the bigger of the two. These only exist in the femur. So you have a greater and a lesser trochanter in the femur. A tubercle, same idea, rough bump. You have those up on the humerus, so you'll have a greater and a lesser one here. You'll see some other ones. A tuberosity is more like a rough patch. So it doesn't stick out as much. It's more like a rough area along the bone. So a deltoid tuberosity along the shaft of the humerus is a rough patch for the deltoid muscle to attach, specifically the tendon for the deltoid muscle to attach. So sometimes they're named for what bone they're on. Sometimes they're named for what muscle might attach them, but they're going to be rougher if you were to like touch them. Versus articular, they're going to be smooth, because you're talking about places where bones are rubbing next to each other. And so we have really two major ones that are sticking out. There are flat spots for articulation, but they're not processes, so they're going to look like this. And so a flat spot for articulation would be something like a facet. So this is going to be like a flat surface with a flat surface. I guess let's do, so we have a bump. Let's make this a big bump, but it's rough. And then this is a bump that's rough, but not as big. And this is more like a flat spot that's got our bumps on it. Spines are going to be more archy. Crests are going to be more archy. Kind of, again, same thing usually. Facet, flat. Then you have heads. These are going to look round, and they usually have a neck, so a part that sticks underneath them. Bad art, but you get the idea. And then we have condyles. A condyle, it reminds me of a rocking chair. So you have a surface like this. And so you have like the leg of a rocking chair. So a condyle would stick off of something and arch, kind of rock back and forth, versus a head kind of round in all directions. So that's what makes those different. So flat spot would be a facet. You also have pockets. So you kind of see it here, like this condyle's going to arch out. You have to have something on the other side that concaved in. So if you're going to be on the other side, that would be something like a fossa. And so flat spot, facet, and then a fossa would be like an indent. And that's going to be our fossa. And so this would be like a fossa here. And so you'll see sometimes that they pair up, where the arched part that sits in it has the same name as the fossa. So if you're looking at, let's do this one, olecranon. So here's your olecranon process. It's something that sticks out, is actually your elbow. And then if you extend it, oh, it disappears. Where'd it go? Well, it goes into the olecranon fossa. So the fossa is the little pouch that, or pocket behind, that the elbow can sit in. And if you look at the front, there's a coronoid process, and then there's a coronoid fossa, and the coronoid process, when you bend this way, goes into the fossa, the little pocket. So indent or a pocket, if you kind of think of it that way. I kind of use the word pocket here, but this is an enclosed pocket versus like an indent like this. All right, hopefully it's helpful to kind of see the different terminologies that you'll use in the skeletal system. So that way, as you start naming structures, you can translate in your head, like, oh, it's telling me it's a rough structure that's really big for tendons and ligaments to attach. And like, oh, yep, I feel it, I can see it. And then having that translation allows it to stick a little bit better, because you're telling yourself the story, not just memorizing a term. Thanks for watching.